diagnosis of FMD, it's not just about spotting the virus in an animal or in the population, but it's also very important to have a proper differential diagnosis to know that it's FMD and not another vesicular disease. But also very important is to know which serotype it is or which topotype, so we know that we have the correct vaccine that we need to use in the population for its control. On top of that, it's also good to know the molecular epidemiology of the virus to check, like, is there different incursions, is there different viruses circulating, and that's why we need to have currently good serological vaccines. Also, we have good molecular diagnostics now. Another very important thing now with the vaccination, with high quality vaccines, is to do post-vaccination monitoring, where we use NSP ELISAs to make sure that we're having vaccinated animals and not infected animals. And on top of that, nowadays we can also start looking at novel diagnostic techniques, like our different sampling frameworks. We can use rope sampling, we can use air sampling to avoid having to touch the animals, and then to use all this data to do things like portable PCR in the field, so we have a diagnosis not in the laboratory but actually 1 hour after we take the sample. Or we can even think about not just checking for FMD but doing multi-disease testing using metagenomics, so we actually get a whole picture of what's happening along the value chain, like whether it's in the farm, whether it's on the slaughterhouse, or whether it's on a truck or wherever, so we can really see that we have disease-free zones or disease-free compartments, which will really help with the control of FMD in the future.